Good afternoon, everybody, and welcome to the webinar on the IHI Call 1 topic, an innovative decision support system for improved care for patients with neurodegenerative diseases and comorbidities. My name's Catherine, and I'm going to be your moderator for today. And before we get started, I just want to share some information with you. Firstly, we're recording this webinar, and we will publish the recording on the IHI website, along with the slides and the participant list for people who agreed to be part of it. And also, of course, information regarding future IHI Call topics should be seen as indicative and subject to change until the official call launch, which should be next week. If you have any questions, feel free to drop them into the chat at any time. We'll get to them at the end. We have, of course, online with us Elisabetta Valdano, who's the scientific officer responsible for this topic, but we also have Desmond and Carolina from the legal team, and they're on hand as well in case there are any legal questions later. And we also have Tom from the communications team as well assisting. So plenty of people to help you today. And on that note, I will hand over to Elisabetta.
So good afternoon, everybody. I hope you can hear me well. And first of all, I would like to give you a little overview of the content of today's webinar. We will do a very short introduction to the overall IHI program. And then we will go to the meat, that is the description of the Call 1, Topic 1, and looking first at the challenge, the need for public collaborative research, and then, of course, the scope, the outcome and impact, and the budget. We will also say something at high level on how you can submit your proposal and how this will be evaluated. And I will give you a few preparation tips. Today's webinar will not cover rule and procedure. There has been already a webinar on rule of procedure that is available both on YouTube, and you can have also the slides are on our website. And importantly, I encourage you to attend the webinar that will occur next Monday afternoon at the same time as this webinar, that will give you much more detail and where you will be able to ask all the questions that you want on how to prepare the budget of your proposal. And the registration link is available on this slide and, of course, on our website. So just to give you a very high-level introduction on what is the Innovative Health Initiative. This is the new European Union partnership in health, and is a partnership between, on one side, the European Union, represented by the European Commission, and on the other side, the Healthcare Industry Association of COSIR, that cover companies that are active in medical imaging, radiotherapy, health, ICT, and electromedical also industries. Of course, the EFPIA Association, including also Vaccine Europe, that is the pharmaceutical and vaccine industries. Then we have Europa Bio, that is the association of the biotechnology industries. And then last but not least, we have MedTech Europe, which is the association umbrella for the medical technology industries. IHI has been given by the legislators very ambitious general objective, really, that are about how to turn research and innovation into real benefits for a patient and society. In short, how to the idea is to get out the innovation from the lab and get them really in the real world, that can be, of course, the hospital and the doctor office, and get them to the patient. And to do this, the idea is to really consider how to enable a delivery of safe, effective healthcare innovation that cover the entire continuum of care, which is really looking from prevention to diagnosis and treatment, and in a very holistic way, and of course, in particular in areas where there is still a very much unmet public health need. And last but not least, of course, an important objective is to make Europe health industries globally competitive. The objective of IHI, they are further described more in depth, and under also is specific objective in the strategic research and innovation agenda, which define the focus of IHI, that is importantly on cross-sectorial approaches to facilitate the creation of new products and services. Again, importantly, that have to go through the whole continuous healthcare, so to prevent, intercept, diagnose, treat, and manage diseases, and also foster recovery more efficiency. And the goal is really to lay foundation for development of future safer and more effective healthcare product and solution that could really respond to unmet public health needs, and they can be implemented into the healthcare system. All this should be done still in a pre-competitive environment, and the research support by IHI should indeed remain at pre-competitive level. So now the topic that we'll talk a little bit about in this webinar is part of the call 1, which is a single stage call. So what is the single stage procedure? So now we are approaching the call launch, as Catherine says, next week. And then this will be the moment that actually I hope that many consortia have already started a long time ago to put themselves together in consortia, which have to aggregate together all the important actors that are needed to achieve the objective, the outcome, and impact of the topic. So in this case, everything has to happen together, and the consortia is their own responsibility to really find all the different members that are appropriate for the addressing the best possible the topic. They have to write a proposal. Then all the proposals that are found eligible for the call will go to a competitive evaluation with an independent panel of experts, and the outcome will be a ranking list for which a project will then be funded in the ranking order. So now a little bit more about what is the specific topic we talk about today. So as Catherine said, the title is an innovative decision support system for improved care pathway for patients with neurodegenerative disease and comorbidity. And what is the challenge that is behind this topic? The challenge is quite clear, is the fact that if we think about neurodegenerative disorders, these disorders still represent a very high societal burden impacting patients, their families, and the public healthcare systems, because in a nutshell, we still understand very little about the disease, and therefore we still know very little how to best treat the patient in the evolution of the disease and from the different steps, from the diagnosis to the treatment and to the care. In addition, this is further compounded by the fact that very often patients that they have a neurodegenerative disorders also have one or more other conditions. And this means that, of course, the disease status become much more complex. Also, these patients are often treated with a real cocktail of different drugs and different treatments. We create an observed polypharmacy, which even create more complexity in the system. And really, we need to understand better if we want really to optimize the current care pathway for this patient population. It is also quite clear that this is not a challenge that one or two group of stakeholders could address on their own. It is clear that in order to address properly this challenge, it is needed a trusted, collaborative, cross-sectorial and multidisciplinary public-private partnership. And it is why this is needed is because, first of all, if you want really to create a useful and usable output and long-term impact, it is of utmost importance that the end user, which are of course the patient, but also their family and carers, the doctor, the nurses, and the healthcare provider are included from the very beginning in the partnership. It is also very important if we want to really to create some meaningful convergence of technology that will create innovation to improve healthcare, that all the different healthcare industry sectors are included in the partnership. Last but not least, since different aspects that require different speciality from the scientific field, but also including, for example, from the social science, it is important that the relevant interdisciplinary academic competencies are included in the consortium. And this is the only way to ensure that all outcomes will be achieved. With this in mind, it is what is really the scope of the topic. So the what is really to develop a decision support system to enhance medical decision with target clinical knowledge, patient information, and other health information. And this has to be done addressing a patient population with a neurodegenerative disease that has to be chosen by the applicant, considering the evidence of the importance for this disease of the comorbidities. The choice of the comorbidity is again free for the applicant, and for justifying their choice, that they will have to be done very carefully in the proposal. The applicant should consider the burden for the patient, the carrier, the patient, and also the availability of medical technology generated data for this comorbidity. There is only one disease area that is excluded, which is cancer. And why this should be done? So the applicant should consider how they could achieve a more holistic, meaning breaking the silos across medical specialty, approach to managing treating patients with neurodegenerative diseases and a comorbid condition. And this should be done considering what are the needs of the patient today. But this is a field in a high-speed movement, and there is also some hope on the horizon that there might be some future paradigm shift in the treatment of this patient. But it's important, therefore, to create a preparedness when this treatment could appear. And last but not least, it's important also that the applicant consider the fact that they should look at improving care and treatment outcomes for the patient, and consider important aspect of implementation into routine care and of sustainability of whatever solution they could propose, because these are important barrier that, if it's not tackled, could really hinder the development and distribution delivery of innovation to the patient and to the healthcare system. And applicants should propose a program of activity that should address all the outcomes that are specified in the topic. And here I just highlight. The first important outcome is the creation of a digital platform. And in the topic test, you have a lot of details on what can be the characteristic that should be considered. But important point is that this should be both for the patient and for the healthcare professional. It should be easy adaptable for use in other healthcare areas. And also, it is, as specified in the topic test, is important that the applicant consider what is already out there. So there could be a good scope for utilization of some platforms that are already there, or element thereof that could be used without, again, for reinventing the wheel. Another important aspect is the creation of a sustainable framework for collaboration across the specialty and the stakeholder. Once the work of the consortium will create, and this important collaboration will start to break the silos, it's important that this is sustained. And this is important not only for development of science, but also to foster social innovation. To guide this and to really increase success, it is important that applicants pay attention and look at how they could contribute to standards and guidelines, both to the collection of data. The topic is also a lot of emphasis and explanation on the various types of data that should consider, and on the importance of data quality, and on the operation of the digital platform. And this is because it's necessary for enabling medical technology innovation. Applicants should also consider how they could have as an outcome enhance a more reliable tool and method for near real-time feedback on health intervention, which could be used jointly by patients and doctors in the decision-making on what is the best pathway for an individual patient. And last but not least, is important outcome that is expected is an enhanced clinical interpretation of complex data that are influencing variation in patient status and required care. And this is absolutely important if you really want to deliver some benefit to the patient, and also to the healthcare provider that always have very limited resources they need to put in the right section of their budget. In the long term, it is expected that the project created by a big topic will have some important impacts. First of all, an enhancing of cross-sectorial collaboration between healthcare industry, academia, and all the relevant actors in the healthcare ecosystem for strength of resources beyond data. So this is not just an exercise to exchanging data, but it's really to exchanging culture, to create a new holistic ecosystem that is much more than the sum of the different stakeholders. Of course, it is hoped that the long-term impact will be the earlier, more precise diagnosis, more clear effective intervention, better treatment, and reduce hospitalization of the patient. It is also important to think that the important impact would be a better stratification that could be help to better predict clinical outcome and support a more patient-centered intervention, and also therapeutic that could be completely novel one. Important is, of course, put always the patient at the center. There is a big emphasis on, for example, considering patient-reported outcome and patient preference measure. This to really look at patient clinical outcome, improve patient experience for patients with neurodegenerative diseases. And also, it should be considered a long-term impact to create really a more cost-effective and better prepared pathway management for patients with neurodegenerative disease, and contribute by the way in which the data will be handled, will be considered also to the development of the European Health Data Space objective. Of course, we said that, of course, the project will make some activity. They will have also to then engage the stakeholder, and to do so, it is an important aspect of dissemination, exploitation, and communication. You will see when you read carefully the proposal template that indeed there is a lot of emphasis on this aspect, and this will be something that will be looked at very carefully during the evaluation. And this is extremely important for the taking up of the project after the end of the project result, after the end of the activity, and most important also for a really long-term impact. Therefore, it's extremely important that you fill and describe very well this in your proposal, considering the activity that you plan, but also considering carefully all the target group that you should address. And last but not least, you need also to reserve sufficient resources for these activities, because otherwise it will not be possible to achieve all that you plan to do. Considering the budget and duration there are for the project to generate on this topic, there is a total budget in this topic of 15 million of public funding. And there is an estimation that possibly a financial contribution around 5 to 7 million should allow a proposal to address a topic outcome appropriately. Nevertheless, as indicated in the topic test, applicant can also apply for different amount of public funding, but of course they have to clearly justify that this has to be done in many cases why they make this request. And also, of course, a very important aspect is that at least 45% of the total budget of each project must be covered by contribution provided by the IHI private member, so the member of association that I mentioned at the beginning, but also this could be by via contributing parts. For what concerns the duration, also this is really up to the applicant to propose the most suitable, but of course realistic duration that has to be adapted to the project activity and the expected outcome and impact. So since we know that it's really complicated and very to think in theory about this design of the potential topic for a proposal, here I just show you a very simplified example of a budget. Then there could be all the different, of course, variation. But a simplified example for a budget that would be found eligible is a budget of a proposal where the total costs are of 10 million, and these costs are for the public partner, which can be university, hospital, but also SME, patient organization, regulators of 5 million. They have a request, a total funding of 5 million. And then we have also private member, contributing partner, that also have a total cost of 5 million, but they don't request any IHI funding. That means that in the total cost, we will have a perfect 50 to 50 balance, which will be okay, because this means that the contribution are more than the threshold of 45%, which is where it is the really minimum for being eligible to go to evaluation. So now let's go a little bit more on the steps for the proposal submission and to the evaluation. So you will see that in your proposal template, you have two parts, the part A, the part B, and then you have several annexes. All these need to be filled carefully and need to be part of your application for the application to be considered complete and therefore eligible. We have the part A, where there is all the administrative data and is entered through the funding and vendor portals online. And then there is the part B of the proposal, which is the narrative part that includes three parts that correspond perfectly to the three evaluation criteria. You will see there is quite a lot of detailed instruction to guide you in the template, and really stress that it's extremely important that you read this carefully and try really to make your proposal at the best as possible to fit with this instruction. Then there are some annexes that also are needed, and so you must not forget them. One is about the participant type. The other one is the one that will provide all the budget detail. And then in case you intend to propose as part of your submission some clinical studies, then it is compulsory that you also provide a clinical studies template. The evaluation criteria included three criteria. Excellence and impact are the first two. And these criteria include each as two different sub-criteria, which is the first of all, declaring the pertinence of the project and extend that the work is ambitious and go beyond state of the art, which is of course an important aspect, but is also equally important that you show that you have a very sound methodology that look at all the different aspects, the model and assumption, interdisciplinary approaches, appropriate consideration of the gender dimension, research and innovation, of course, the quality open science practice, and also including sharing and management research output, engagement of citizens, civil society, and end users as appropriate. And indeed, for this topic, it is extremely appropriate, I would say needed. The second section is the section on impact. And here you really have to describe what is the pathway that you envision to create impact. And this is, of course, how you get first to the outcome, and then, of course, from there, in longer term impact. And also, you need to have provide some consideration on the scale and significance of the contribution that your proposal will, your project will give to this outcome and impact. And of course, you have to demonstrate also the how. So you have to demonstrate the suitability and quality of the measure to maximize the expected outcome and impact. And this you will do via your dissemination and exploitation plan, including also communication activity. The third criterion is the quality efficiency of the implementation, where you will have to describe your work plan in order to give a good idea to the evaluator on the quality and effectiveness of your plan, how you assess risk, the appropriate effort assigned to the work package, and in general on how you organize properly your work to achieve your objective. It is important, of course, that you describe carefully the capacity role of each participant, understand how you can make everybody to work together in the necessary expertise, but also to create a sum that is more than the single part. And of course, considering also importantly the fact that you are creating public-private partnership, and this should be really reflected in all the way in which you describe your scientific work, but also your governance of the project. So just to finish some tips for you. As I said again, and I couldn't repeat it more, read all the core relevant material. I know it's boring, certain things can be really not fun, but it's really important. Of course, the topic text is important. It's pretty short, but a very dense document. So please try to really read every word. And but as I say, it's also a single stage, so it's up to you to provide the better interpretation of the text. And here you have the places where you can find of information. Of course, it takes time to get together a good consortium. So we hope really that you have been starting working on this already for some time. As said before, always think public-private partnership, because that is what you will deliver. And that is really the only way you will really be able to achieve properly all your objective, and then the outcome, and then the impact. And remember the fact that you need in-kind contribution to be eligible for then get to the evaluation. Of course, ensure that the expert reviewer will find easily all information requested in the call text and the proposal template, because you know how it is. If it's nice to read and simple, it is always best received, but it become a little bit, let's say, less easy to read. Yeah, already people maybe get a little bit irritated, and this, of course, could make the reading more difficult, and the reading more difficult to get the point of your proposal. So please try to write in a nice and an easy way what is your message and what is your plan. And then consider also a plan for the potential regulatory impact of results. It is in fact necessary to consider this if you really want to get to something that in future will be implementable. And that is what is wanted. Of course, important is finding project partner. You need to build or join a consortium, of course, because we are collaborative research. And of course, use your possibility for network, webinar, also the brokerage now marketplace has been reopened. So please, there will be a possibility also to continue working and networking using this, this tool. Of course, there is the EU funding internal product partner research tool. You can reach out to your national contact point, to the state representative for IHI. You can also use all the different social media. In short, try all that is usable for you. And of course, if you have any question, we are there also to answer any question. Okay, and I think I would like to stop here, since the additional slide is only needed if some questions to be answered. Thank you for your attention. I hope it was clear enough.
Thank you very much, Elisabetta. We do already have some questions, so I'm just expanding the questions pane here so we can read them easily. Okay, the first question is for you, Elisabetta. What would be the potential role of national patient organizations in the projects?
Well, it is really, I mean, the national patient organization, of course, could be, they are valuable partner, as could be European patient organization. There isn't any limitation. So it's really up to the consortium to consider how this organization, this partner, could help to achieve both can be useful for the activity. So how could they contribute some of the activity of the topic, and in this way also, of course, contribute to the outcome and the impact. So again, this is a single stage, so it's really up to the applicant, but there is no limitation on the fact that the organization is national, European, whatever.
Okay, thank you. Another question which maybe you want to start, Elisabetta, but then we might also hand over to the legal team. What exactly do you mean by pre-competitive stage? Can you have a participating SME commercialize the outcomes of the project by the end of the project?
Well, there is nothing against it. It's just important to say that the scope of this topic is really not about a specific product. This, let's say, could be a buy result. But it's really to create this important collaborative approach, and also to really disseminate as much as possible the output in order to achieve the impact. So it is expected that indeed the outcome and the result will be shared as much as possible if the impact will be achieved.
Another question then for you, Elisabetta. Patients have multiple comorbidities. Should we focus only on one?
Again, the topic is not prescriptive in this. It's up to the applicant to make their case, if they should address one or more.
Okay, another question on the deadlines, saying at the brokerage event, the deadline for proposals seems to be September, and is this enough time, and why isn't the call launch earlier? I mean, it is usually 3 months, the deadline, and this is also why we published the draft call texts online earlier, precisely to give you that extra time.
Exactly.
I don't know if you want to say anything else, Elizabeth. Or...
No, I think that I can't say anything.
Yeah.
These are the timelines.
Yeah. Is the next question is for you, Elizabeth. Is the call focused on making a digital platform and not new methods?
Well, I would really recommend that you read carefully the topic text, and indeed you will find both reference to a digital platform and to methods. So please read very carefully the topic text.
And I would add as well, I mean, the topic text, as Elizabeth said, the final version will be published along with a lot of other documentation around the time of the call launch. Read it carefully. And if you have questions as well, if something isn't clear, on the one hand, as Elizabeth said, yes, there is a lot of scope for you to interpret. But if something isn't clear, if you do not understand, then do ask us as well. That's a very important point.
And I would like to say also that the draft topic are also really, the content is not different to what you will see in the final version.
Okay, that's good for this topic. Next question. Is it expected to validate this platform under a clinical trial?
As I said, again, it's up to the applicant consortium to see if they think that this will need it to achieve the outcome and the impact. Consider also, of course, that you have a sort of limited budget and that you are supposed to achieve all the outcome with this budget. So it's up to you, but consider this important aspect.
Okay, thank you. We have a couple of questions now, which I am going to direct to Desmond because they're more procedural and legal. So the first question, can a private company be both a public partner and a contributing partner? I don't know if Desmond is
I don't know.
there.
Otherwise, I'm also happy to.
Yeah, okay.
Can you guys hear me now?
Yes, we can.
Sorry. All right. So thanks for the question. I think it comes down to exactly how we understand and how we define those terms. When we talk about a public partner in the context of an IHI project, what we're really talking about is a beneficiary in the actual consortium, and it's anticipated that they're going to be receiving funding from IHI JU. We're basically going to remunerate their costs. This is fine, and that would be how the normal public partner would operate, and a private company in a very similar way. As a default position in the single stage calls can indeed receive funding just like the public partner. So a private company can be a beneficiary. This is clear. A contributing partner is a slightly different entity under IHI. What a contributing partner is it's a legal entity, like it can be a private company, it can also be a philanthropic organization or one of the large foundations. And what the contributing partner actually does is it identifies topics that are of interest to it in its own portfolio, and it applies to the IHI governing board and basically says, we want to become a contributing partner to this specific topic, and we're going to contribute in kind or FC, financial contributions. So what I would say is that it's not possible to do two at once, but what you could do is be a contributing partner. If you were accepted by the governing board, you would contribute to the actual project. And in a very, very narrow sense, you could conceivably receive some funding like the public partners, but I don't think that would be the preferred mechanism. I think the preferred mechanism and expectation is that if you're going to be a contributing partner, then you're actually going to be contributing to the actual project, either in terms of in kind for operational costs or indeed for a financial contribution.
I can maybe also complement, because I'm not sure what was the reading of what the person that asked the question, if meant by contributing partner, if it meant a contributing partner in the sort of legalist jargon of IHI, or it could mean simply an entity, a company that was making in-kind contribution. Mm-hmm. So in the case of this second word, I mean, as Desmond say, indeed, in the single stage, they can both receive funding and be contributors. So there are so-called hybrids, let's say, contributors. So just to be sure that everything's not clear what was contributing, meaning in the for the person to make the question.
And the next question, which you touched on it very briefly in your last answer, Desmond, can contributing partners also contribute cash rather than in kind?
Yeah, so the cash would be reflected if it's coming from the contributing partner as a financial contribution to one of the other beneficiaries in the project. So we have contributing partners, as I said in the previous answer, contributing two ways. One with these financial contributions, which is cash or in kind for operations, but contributing partners cannot, under the legal basis that we have, contribute in kind towards additional activities, and this is clearly established. On points like this, it's already been mentioned, but I would really refer everyone to the rules and procedures webinar we had almost 2 weeks ago, and it's about 2.5 hours long, and we go into these kind of questions in quite a lot of detail.
And we also, as Elisabetta said, on Monday, so next Monday, we will have a webinar purely on the financial aspects, because, you know, this and the 45%, it's new under IHI. We know there are a lot of questions, so all these kind of questions should be addressed there as well in a lot of detail. You know, the question of, as Elisabetta said, these hybrid partners, I think all of that will be addressed on Monday. So do sign up for that webinar. And if you can't make it, we will of course record it and put all the slides online as well. So don't worry if you can't make it. Next question is back to the topic. So one for you, Elisabetta. Is building on an existing platform or infrastructure from previous projects, etc., a must?
So this is again a single stage topic. So there isn't any must. There are only some recommendations. But it's clear that applicant, if they decide to build something completely from scratch, they will have to give a strong justification, and they will have also to make a proper, demonstrate that they made a proper landscaping, to demonstrate that there was really nothing out there they could build on. And last but not least, they have to consider that there are many different outcomes that have to be achieved by this topic. Therefore, they have to consider if there would be enough cost both to create from scratch a platform and also to achieve all the different outcomes. So these 2 points, I think, have to be bear in mind.
Okay, thank you. And next question is also for you, Elisabetta. What kind of experts in terms of their profession will be the evaluators of the proposals? Will it be the same setup as the interdisciplinary consortia?
Well, of course, we will have a very mixed bunch of experts that will be able to look at all the different aspects of the proposal, as indicated, of course, on the topic. That will be their Bible. So that's what they will be referring to.
And again, I mean, we get the experts from the European Commission's database of experts, and they will obviously have to sign conflicts of interest and things as well, declarations there. Another question on the topic, what are the expectations on contributing to the EU health data space objectives?
Well, say this is a sort of long term. Is it indeed in the impact? Because we all know that this is very much work in progress. But of course, it is important that in the work, the applicant consider what is already there, what is the spirit, and for example, things like, of course, looking at fair data and all the other interoperability and so on, which are already something that one can read in the long-term aspiration of the EU Health Data Space initiative.
Okay, thank you. Another question on finances now. Is there an official statement on the participation of non-EU consortium members and how these members would contribute to the funding calculation?
I think, well, the short answer is no, there's no official statement. I think what is official is that in terms of the funding calculation, and when we talk about the funding calculation, I presume we're talking about the 45%.
I know what it is.
Oh, okay, then I'll hand over to you if you've got a grip on it.
So, there is indeed that we have overall at the program level a 20% in non-EU in kind, but indeed this has been waived in the sense that it's been defined at 100% in the for this call 1 and call 2, and this is official. And you have already said that also in the topic in the webinar on rule and procedure, correct, Desmond?
I think, well, we put, if we're talking about the non-EU calculation, then this is clear, because there's 2 points. We maintain the program non-EU level at 20%, but in the actual specific calls, we've expressly said, and this is in the work plan as well, that the limit for non-EU per project is 100% for calls 1 and 2, and that's very, very clearly spelled out now.
Okay, so indeed it's official.
Yeah.
Again, this will be, all of these sums and calculations will be in the webinar on Monday, so really do sign up for that one. I don't see any new questions for now. I'm just going to quickly check that there isn't one hiding in the question and answers panel as well, because sometimes there's one there. So, no. So if you have any further questions, do type them in quickly. Otherwise, as we said, we'll be launching the call in the next few days. There will be a lot of information landing on the IHI website, a lot of documentation, and as Elisabetta said, we know it can be quite tiring to read it. There's a lot of things to read, but it will really help you in your application if you understand IHI, what it is, what we want to achieve globally, how we work. It will help your application. Okay, another question has come in. What is the expected TRL level for this topic? Technology readiness levels we're talking here.
Again, there is not an expected technology readiness level for the outcomes. So this again will be up to the applicant.
So these topics, they're very different from the previous topics that we used to have in IMI. They're much, there's a lot more openness and the texts are much shorter, but yeah, there's a lot more on applicants to justify their decisions.
Indeed. Just please read carefully the outcome that and then the impact.
Okay, thank you. Okay, I don't see any more questions for now, so I will say thank you very much to Elisabetta for her presentation and for answering questions. Thank you as well to Desmond for answering questions, as he's been doing for all of these topic webinars. And again, if you have any questions about the financial aspects, then please do join us on Monday, where we will be talking about that and nothing else. So thank you very much, everybody, and good luck with your proposals. Thank you, everyone.
Thank you.